Thank you, Claudia, for that wonderful warm welcoming. And I want to welcome everyone to tonight's presentation. Hopefully, by the end of this session, you will understand the link between blood sugar and bone, joint, and muscle health. All right, let's just get started. So again, just a little disclaimer, this information for today's session is for not intended for medical advice. Please always consult with your healthcare professional before making any changes to your diet, exercise routine, or health regimen. So just to give you a little overview on diabetes, there are two types of diabetes, type 1 and type 2. Type 1 is an autoimmune condition where the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. These leads to little or no insulin production and typically develops in childhood or adolescence, though it can occur at any age. Type 2 diabetes, on the other hand, is a chronic condition where the body becomes resistant to insulin or doesn't produce enough insulin. It is more common in adults and is often linked to lifestyle factors such as obesity, inactivity, and diet. Genetics also play a role in it. So let's just look at musculoskeletal system. So what make up this whole musculoskeletal system? There are bones, right, which provide structural support, protect organs, and store minerals like calcium. Muscles, they enable movement, maintain posture, and generate heat through contraction. Joints connect bones and allow flexibility and range of motion, such as like knees, shoulders. Tendons connect muscles to bones, transmit force to create movement. And ligaments connects bones to other bones, stabilize and support joints. Cartilage cushions joints, reduces friction, and allows smooth, pain-free movement. So all those things make up our musculoskeletal system. So how does diabetes negatively affects the body? Well, one is it affects uncontrolled, this is about uncontrolled blood sugar control. So that affects poor circulation. When there's poor circulation, it damages small blood vessels and reduce blood flow to muscles, joints, and connective tissue. So that impairs healing. So somebody who's going into surgery, for instance, there is a concern when the blood sugar is not well controlled because it does impair healing and increases the risk of tissue degeneration. And it also negatively affects the body by something called advanced glycation end products, shortened for AGE. So what that do is, if it's just a lot of sugar is not controlled, the sugar, the glucose, binds to proteins like collagen, forming this advanced glycation end products. So this makes connective tissue stiffer, less elastic, prone to injury and dysfunction. And one of the examples, or a couple of examples of that, is frozen shoulders or stiff joints. And it causes also nerve damage, something called diabetic neuropathy, right? It decreases the sensation on your hands and on your feet. With diabetic neuropathy, sometimes even if you're like stepping onto a sharp object, for instance, accidentally, you might not even feel it. So there's that danger of injuring yourself without knowing it. It also causes weakened muscles, imbalance right? When there's nerve damage, there is can lead to imbalance and risks of falls, and also causes inflammation. When there's excessive blood sugar floating around, inflammation can cause joint pain and worsens osteoarthritis. And then it also leads to obesity and mechanical stress, places extra stress on joints, all right, and exacerbate wear and tear of the joints. So when this obesity involves, the reason why it places extra stress on joints is just to let you folks know that every 1 pound that we carry, we are actually putting on 4 pounds of pressure weights on our joints. So there is that significant impact on weight and joint health. And also, excessive blood sugar also altered bone metabolism because insulin plays a role in bone growth and strength. Alter insulin level, whether it could be high insulin level or low insulin level, and excessive blood sugar can lead to reduced bone density and higher risk for fractures. So there's a greater concern for osteoporosis to develop, right, when there is that altered bone metabolism occur. And so one of the common musculoskeletal disorders in diabetes, really. So there are a few of them I listed here that are very common among persons with diabetes, such as carpal tunnel syndrome, diabetic chiroarthropathy, that is stiff hand syndrome, Dupuytren's contracture, which causes fingers to stay bent toward the palm. That places a person's difficulty placing a hand flat on the table. As a nutritionist like myself, that's a great concern when patients develop that because they will have difficulty picking up utensils to eat, as well as difficulty preparing their meals, right? If the fingers are stay bent, that causes extreme difficulty in food preparation and eating as well. And then there is adhesive capsulitis, that's frozen shoulder, limited joint mobility because of stiffness, like I mentioned earlier about age, the acronym age, how that excessive sugar can deposit into muscles and proteins, which can cause joint mobility. And obviously, there's a risk for osteoporosis and diffuse. There's something called diffuse idiopathic skeletal hyperostosis, which is shortened for DISH. DISH is excessive bone tissue growing into your soft tissues, leading to hardening and stiffness in skeletal ligaments and joints. So what that means is really leads to back and neck pain. And this is not very common, but it does happen, is diabetic muscle infraction, where the muscle just won't work anymore. So bone health and diabetes, let's look at that because as we know, insulin supports bone formation. Osteoporosis is more common in type 1 diabetes than type 2 diabetes because with type 1 diabetes, the body completely stops making insulin. So when there's lack of insulin, there will be lack of bone formation. And obviously that leads to increased fracture risk and also causes chronic inflammation, which disrupts balance of bone building and reabsorption. So how do we prevent that, right? Now that we all know like certain musculoskeletal effects with diabetes. So how do we prevent that from happening? Well, number one is the key is to have good blood sugar control, right? We need to manage our blood sugar as much as we could. And also physical activity is very important. Doing something such as resistance exercise, right? Resistance exercise meaning using weights or those exercise bands. Those are very important to prevent muscles or joints from becoming stiff. And flexibility exercises. Flexibility can be like doing something like yoga or playing sports or even involving swimming or just simple things as taking a walk. That is a flexibility exercises because you're using your joints. And also, when those symptoms occur, don't just ignore them. See a healthcare provider right away, and sometimes you might need physical therapy because physical therapy will help with joint stiffness and pain. And very important is, take the medication as directed by your doctor. Because oftentimes when I see patients, because diabetes, sometimes they don't exhibit symptoms. So they're feeling fine sometimes. And when they're feeling fine, some people feel the need of not needing to take their medications. And that can cause long-term health consequences. Right? And the most important thing also to nutrition, because diet management for diabetes is so critical, and what you eat does matters. And diabetes is the only chronic disease that is extremely correlated with the food that you eat. Right? They do play hand in hand. So I'm going to go to a little bit about how to manage diabetes with nutrition. One of the most important thing in terms of nutrition is focus on eating a well-balanced diet. So what does a well-balanced diet means? Well, it means that it should include complex carbohydrates. It should, on your plates, to have lean protein and healthy fats in each meal. When I say healthy fats, meaning such as using olive oil for cooking or avocado oil for cooking, and limit intake on saturated fats, especially buttered and margarine, right? Or eating fatty meat. Preferably, anytime you shop for meat products, try to buy a lean version. If not, if you see fat that are being attached to it, please trim it off before you cook that piece of meat. So you're limiting your saturated fat intake. And also, a good way to sort of measure or gauge what a balanced meal is, what a balanced meal looks like, is by using the plate method. So a plate method calls for half of the plate to be filled with non-starchy vegetables. And the other half is you want to divide it into two, right? A portion, which is a quarter of it, to be lean protein. So what is lean protein? Lean protein or poultry, such as like chicken, turkey, fish, are considered lean protein. And a quarter of that plate also should be whole grains, or you can have starchy vegetables. Some of the starchy vegetables, such as like potatoes, corn, green peas, are considered starchy vegetables. So either you have whole grains or starchy vegetables. Try not to have both on the same meal. Try not to have a potato and then, some pasta or potato with rice. Sometimes having both types of starch on the plates could be overwhelming, could be providing too much carbohydrate or too much sugar in one meal. So this is how my plates look like. It is actually developed by the government, by USDA, and they actually have their own website. It's called choosemyplate.gov. And this is just a simple way of sort of planning out what a balanced meal looks like. And this is applicable to everybody, whether you have diabetes or just eating for healthy reasons. So how that look like is this. So just like what I mentioned earlier, half of your plates, try to aim at, you can never go wrong with or without diabetes, is half of your plate to be filled with vegetables, quarter of it to be filled with starch or starchy vegetables, and then a quarter of it a nice lean protein. Could be fish, chicken, could be turkey. If you want to have beef, you could definitely can have red meat like once a week or once every other week would be ideal, because we don't want to eat too much saturated fat. And on the side, if you want to have a glass of milk or a dinner roll on the side, that would still be acceptable, or a piece of fruit as well too, that will still be acceptable. So choose smart carbohydrates, right? Remember, a quarter of the plate should be coming from carbs, right? But we want to choose smart carbohydrates, healthy carbohydrates. So what is healthy carbohydrate means? Really focus on eating whole grains, right? Such as brown rice, oats, quinoa, right? Those are whole grains, legumes and vegetables. Those are what we call it, choose small carbohydrates. Limit refined carbs like white bread, sweets, and sugary drinks. As we know, those type of food, refined carbohydrates, like white bread, white pasta, sweets, right, donuts, muffins, cakes, and sugary drinks, not just negatively impacting sugar control, but also leads to weight gain as well. And especially in terms of added sugar, causes inflammation also, so it's not a really good food to consume regularly. And also very important to monitor portion sizes, right? Total daily carbohydrate intake matters, because it is those, even with smart carbohydrate foods, let's say you're eating brown rice, oats, quinoa, legumes, all that, it doesn't mean that even though they're healthy, it doesn't mean that you should be eating excessive amount per meal. There's still limitation on those healthy carbs, how much you eat. Generally speaking, we want to aim at, depending on your activity level or your weight status, anywhere from 2 to 4 servings of grains per meal is considered acceptable. All right, again, based on your activity level and your body weight. So there is, again, limitation on even healthy carbohydrates. So portion size definitely matters. So eating, you might be having pasta for tonight, having a whole wheat pasta, having a full plate of pasta is not generally ideal, right? If you can decrease the size, have some protein with that pasta, have some vegetables or salads with that pasta, is more what we call a balanced meal. So what is not to eat? Please limit added sugars. I can't say that enough, because sugar really contributes to poor sugar control. Avoid intake of sugary beverages, sodas, juice, sweetened tea. I don't care if you're drinking juice that is made from 100% fruit juice or organic fruit juice. It doesn't matter. Once juice is in a liquid form, it absorbs right into your digestive system right away, which means it causes your blood sugar to go up immediately. So having juice is not the right thing to do. It is very different. Eating a piece of fresh fruit, for instance, your body reacts very differently than compared to drinking a cup of juice. All right, because when you eat a piece of fresh fruit, the fruit needs to be digested. So the blood sugar from that fruit is actually absorbed into your bloodstream at a very slow pace. So it doesn't cause that spike, right? Versus when you're drinking a cup of juice, where it absorbs into your bloodstream at a very rapid rate, it causes that blood sugar to spike immediately. So it's not a good thing to be drinking juices. And also read nutrition labels for hidden sugars. So there's certain things, sometimes you'll be very surprised if you bring a packaged food home. You thought that there would be no sugar in the package, but it turned out there is hidden sugar in there. I just want to let you folks know that there are certain words that appeared on the ingredients of food labels that mean sugar, such as, for example, glucose, fructose, lactose, galactose, dextrose. So any word that ends with an OSE on the word, on the food label, as one of the ingredients, any word ends with OSE, that means there is sugar in the product. So sometimes manufacturers might use fancy words to disguise added sugar in there. All right. And also choose naturally sweet options like fresh fruits. But even with fresh fruits, please eat it in moderation, because excessive fruit intake, even though fruits are very healthy, excessive fruit intake, because they all naturally contain sugar, can elevate your blood sugar level. So be mindful of it, not to eat fruits excessively. So generally speaking, you can have 2 to 3 servings of fruits per day is acceptable. And also, try to control sodium in processed foods, right? High salt intake raises blood pressure. It is a common issue in people with diabetes, is having high blood pressure. And also avoid any processed meats, especially something like spam or a lot of the dairy meats, such as like ham, can have excessive sodium and also excessive fat. Canned soups, for instance, we need to be very cautious with canned soup as well too. Even the low sodium version, oftentimes they are really high in salt. And fast food. Fast food also contains a lot of salt in them. Just to let you folks know, the recommendation for salt intake per day is just 1 teaspoon. 1 teaspoon of salt a day is what the American Heart Association recommends. All right. And that equivalent to 2,300 milligram. If you want to convert 1 teaspoon of salt, that means it's equals to 2,300 milligram of sodium. So with managing diabetes, it is important to include healthy fats in your diet, because those healthy fats, such as like olive oil, nuts, seeds, avocados, what they contain is something called omega-3 fatty acids. So those omega-3 fatty acids help in many different ways. One of them is it decreased inflammation in your body, but also omega-3 fatty acids also has a cardiovascular protectiveness, all right? It protects your health, your heart health. So it's very important, especially due to diabetes. Diabetes, having the disease itself, increases your risk for cardiovascular disease. So including good fat that contains high concentration of omega-3 fatty acid is highly recommended. Avoid eating trans fats, all right? Trans fats you might found in a lot of bakery products, and limit saturated fats, especially, again, buttered, fatty meat, and deep fried food. Eat regularly. Don't skip meals, all right? I know a lot of people could feel like, if I'm not hungry, I shouldn't be eating. It's not true, because even when you're not feeling hungry, having a little bit of food will actually helps to maintain stable blood sugar level. So consistent meal timing is important, again, to stabilize your blood sugar level. So if you have a habit of skipping meals, I highly discourage you from doing that. And also sometimes include a snacks, especially prevents from having loads for those folks who are on insulin. A lot of time having a snack in between meals might not be a bad idea. Again, this is to prevent from having a low blood sugar. So in conclusion, good blood sugar control is the key to prevent diabetes-related complications. So remember how I talked about earlier, all those musculoskeletal conditions can occur with high blood sugar. So guess what? If you're having good blood sugar control, the likelihood of having those complications will be significantly less. Again, please seek medical care right away when musculoskeletal issue arise. Do not ignore those symptoms. And healthy dietary pattern and healthy lifestyles are a great complements to diabetes management. So include not just having healthy diet, but also include exercise if you can into your daily routine. What that means is, healthy eating, staying active equal healthier you. All right, so I will give back to Claudia if anyone have any questions. Oh, by the way, this is diabetes resources. Anyone who's interested to seek out more information on diabetes, the Diabetes Association have wonderful information on not just for diabetes management, but also free recipes. All right, any folks who are looking for recipes, they have wonderful recipes on that. And the Academy of Nutrition and Dietetics also have wonderful resources on diabetes management, as well as the National Institute of Health and NIH have wonderful collections of research articles and ongoing research on diabetes care as well. So yeah, so I will open to Q&A.
Excellent. Thank you so much, Sue. I really appreciate how you highlighted that the role of nutrition and eating with diabetes is an important prevention to all of the different muscle and bone and joint conditions that you talked about earlier in the webinar. So thank you so much for highlighting that. We will now take some audience questions. And first one I see here is, do people with diabetes need to think about anything special regarding their nutrition, the foods they're eating or not eating, if they're getting ready for an orthopedic surgery?
Yeah, so having, again, like emphasizing a well-balanced intake, or like with or without preparing for surgery. So eating whole grains, having half of your plate, always emphasize on having half of your plate to be filled with non-starchy vegetables, and having good intake of protein food, especially for folks who are preparing for surgery, protein is so such an important nutrient to help with healing. All right, so sometimes to have extra protein storage prior to surgery might be beneficial for healing after surgery. So when you're preparing for surgery, emphasize on eating protein food and complex carbohydrate, right? All those healthy carbs, a small portion of it, and lots of non-starchy vegetables.
And speaking of starchy food, should they just be avoided entirely, like breads, pasta, rice, and potatoes, or can they be eaten in moderation?
Yes, please do eat that in moderation. I actually don't recommend for you to avoid eating starchy food because starchy food is still a very important contribution to our health. Excessive amount is no good, but the most important thing is our brain actually depends on carbohydrate food for fuel. All right. And sometimes if you lack of starchy food in your diet, your body actually can break down muscles and other areas to convert them into sugar for fuel. So I do not recommend to avoid eating carbohydrate even when you have diabetes, but please do eat them in moderation.
Talking about eating foods in moderation, can you talk to us a little bit about fruit? How should people with diabetes approach fruit? I think we generally consider fruit to be healthy, so is it okay to eat as much fruit as you'd like? That's one question, and then the follow-up, our question is talking about fruit shakes made with protein powder and fresh fruit and how that might work well or not for a person with diabetes.
Yeah, so let's just go to the first questions, right? So with fruits, it even though they're healthy, like I said earlier, it doesn't mean that you can eat all the fruits you want because those sugar content from fruits can add up and can negatively affect your blood sugar control. So the best way to look at fruits is I do want you to eat fruits because they contain, a lot of different vitamins and minerals and fibers that are so beneficial for our health. Just limit your intake to 2 servings of fruit a day, regardless of your activity level. And treat the fruit, sometimes treat it as a dessert after a meal. So for lunch, you can have an apple after your meal, or for dinner, you can have like a cup of berries, for after a meal. And again, like treat it as a fruit. If you use fruit as a snack, it is best to pair your fruit with a protein food. So for instance, you might have like an apple with peanut butter because peanut butter, nuts, right? Seeds, those are actually contain protein. So you can actually pair it with a protein food. So protein couples with the fruit, it just prevents the blood sugar from spiking. So it is important to pair it if you eat fruits by themselves as a snack. All right, always pair your fruits with some kind of protein food. As with smoothies, yes, you can actually make a healthy smoothies, but the portion of fruits that you put into the smoothie matters significantly. So I caution you, but putting a lot of fruits in there. I know some people love to have adding on like frozen berries and bananas and pineapples and all sorts of different fruits in there to make it very sweet. Don't do that. Try to just having a cup of frozen berries. Just choose one fruit. If you want to have a banana, fine, have a banana with your smoothie, but add other ingredients in there. You can actually add something sweetened vegetables such as like carrots, right? And then add some vegetables in there like baby spinach or kale, and then your protein powder in there that you can actually make the smoothie almost like a meal replacement. All right, a very healthy meal replacement by doing that.
Is there anything that people should be aware of when selecting a protein powder, especially if they have diabetes?
I would say look at the nutrition facts label on the protein powder. Make sure that they don't have added sugar. There is, there are a lot of them out there, especially the flavored protein powder, like chocolate flavor or vanilla flavor version of those protein powder. A lot of time they do add sugar to it. So please be mindful, read the nutrition facts label, make sure they don't have added sugar to it.
It's really good advice. There are some questions about fasting. One question about managing diabetes during a fasting period before surgery. And another question about intermittent fasting, which I know has been a popular as of late. And can you kind of speak to fasting and diabetes?
Yes, absolutely. So when sometimes fasting can be voluntarily doing it or involuntary, right? Like you have to do it to prepare for surgery. So usually in preparation for surgery, you might need to stop certain diabetes medication because you're in the fasting state. We don't want you to bottom out having such low blood sugar. So with intermittent fasting, because you are allowed to eat in certain time frame during the day, that might be okay. But again, you might need to adjust the timing of when you take your diabetes medication. So there is caution needs to be made because if you fast, at the same time taking a diabetes medication, it can cause your blood sugar to drop significantly. So just be mindful of that. If you're doing intermittent fasting, as long as you adjusting when you're taking those diabetes medication or adjusting the dosage on the insulin that you're on, it might work very well for you. And studies have shown even with people with diabetes, that participating in intermittent fasting can help them to lose weight and ultimately can have better blood sugar control and also decreased inflammation.
Interesting. I didn't know that. So that's really interesting to know that there have been studies on it.
Yes, so they have a lot of studies done on intermittent fasting. And intermittent fasting, there are few ways people do it. There are few, I guess, models of intermittent fasting. The most common one is you fast 16 hours a day and you eat within an 8-hour time frame. That's very popular. A lot of people are doing that to help them to lose weight, and some people feel better as a result of it. And there's another one is called 5-2 fast, meaning you eat normally for 5 days a week and 2 days you fast. And during that 2 days, you're only allowed to have 500 calories per day. That's that fast. And then there's another fast, what they call it alternate day fasting. So you fast literally like no intake except water for one day, and then you eat another and just keep repeating like that. Eat one day, fast another. So there's a different methods of fasting. Again, the most common one, I'm sorry, the most common one is the 16-hour fast.
But regardless, if anyone is considering fasting, they should always consult with their medical provider to make sure that they're managing their medications to avoid, a situation like bottoming out, like you mentioned.
Absolutely. It is very important to speak to your provider, or if you have a dietitian, have a conversation with your dietitian to make sure that you do it appropriately so that you don't have or develop low blood sugar, because having low blood sugar is very dangerous.
You mentioned medications a bit, just a response ago. Someone asked about GLP-1 medications. Can you speak to those medications, their impact on diabetes, and also their potential impact on our muscle and joint health and bone health?
Yeah, so with GLP-1, the popularity just exploded, right, within the past couple of years. So GLP-1 medications are very effective. From just like observational, seeing my own patients who are taking GLP-1 in terms of diabetes management, they are doing fantastically, each of them having the A1C level dropped. So they are very effective way to manage diabetes. And GLP, because GLP is a hormone that found in the gastrointestinal tract, it delays emptying of food in your stomach. So because it delay emptying, the food stays in your stomach longer period of time. So you actually have this sensation of fullness or the sensation of not feeling hungry for extended period of time. So people actually lose weight in addition to having good blood sugar control, right? And that is the fact. What we have observed for looking at people who taking GLP-1 with having good blood sugar control as well as weight management in terms of weight loss. Now, because of the weight loss, rapid weight loss, sometimes some people actually experiencing rapid weight loss when they lose weight too quickly because the drug suppresses their appetite so significantly that they're not hungry, they don't want to eat, or they forget to eat oftentimes. That can be a problem with bone health because when you lose weight too quickly, it can negatively decrease your bone density as well too. But at the same time, there's a study claim that because of weight loss, that can also impacting good bone health in a sense that actually helps to, because that now you have good blood sugar control and you start to lose weight. And remember how I mentioned earlier about how insulin can play a role in bone formation, right? Because you have better blood sugar control now, you're becoming a little more sensitive to insulin. So the insulin actually can help in bone formation. So which means it can do both things. It can negatively decrease your bone density, but it also can help too because now you're becoming more sensitive to insulin, and insulin helps bone formation. So you have that both
Right,
spectrum
right,
with
like
GLP-1.
it's absolutely, it seems like it is coming from a variety of different angles in terms of building good bone health.
Exactly.
I can't believe it. We are at time for this program, and I sure learned a lot tonight. So thank you, Sue, so much for sharing your expertise. Before we sign off, I guess my final question is, are there any new developments that you're really excited about in terms of diabetes care management? Or what's the one thing that you really would like people to take away from this program tonight?
What I really want folks to learn about this session is that, having diabetes is not the end of the world, right? It can be well managed by diet and exercise. And this is probably the only chronic disease out there that has such a significant impact depending on what you eat. Have a very, very strong correlation between what you eat and how your blood sugar is responding. So with that said, involved with taking good care of yourself, be active in your decision-making process in terms of food choices and what you eat, and, be active, move around, take a walk every now and then, because those exercises, those movement is also part of your diabetes management. Because remember, every step you take, you are actually burning excessive sugar. So you are helping yourself to regulate your blood sugar by doing so.
Thank you again, Sue. It's always a pleasure to learn from you, and thank you all for joining us tonight.
Oh, thank you.